But the problem is the anatomy our brain tries to depict for us during reading is just like the cartoon dog. But the real anatomy is just like a real dog. There's a huge gap between these two. So what anatomy teaching is trying to do is try to bridge this gap by showing us the details and by showing us the outlines, the reality of the real anatomy structures. So with a really rapid growing of today's cosmetic market, there is actually also a simultaneous growing in the quality of the injectors. And so what's more, the background of the injectors is so diversified. There could be plastic surgeons, there could be dermatologists, there could also be nurses, and there could be internal medicine practitioners. So as elegant stuff, what we try to do is to help our injectors to achieve excellency and achieve safety by our anatomy education. But to do this, there are 4 different ways we can do this. We can help our injector to see the reality, to see through the surface, and to see its differences, and also to see its dangers. Take the purest ocular muscle, for example. If you now try to imagine how big could your purest ocular muscle be? Is it as big as this circle, or is it as big as this circle? But in reality, our purest ocular muscle is much bigger than this bigger circle. It's actually the size of the red circle. This is the real anatomy. You can see, you can directly compare this to. The second thing we need to do is to help our injectors to see through the surface. In our anatomy teaching, of course, we can tell them about all those details of the anatomy of the corrugator, like insertion, origin, insertion, nerve innervation, function, and also classification. But what the injector really wants to know is where to place them. So it is much more helpful if we can tell them in real clinical situation, if you can easily find your corrugator in the 2 vertical lines passing through the medial canthus and also the pupil, and also superior to the horizontal line passing through the superior orbital rim. And number 3, and also for the injection for the CrossFit as well, we can of course show them the anatomy figures of the purest ocular muscle and tell them there could be multiple complications after injection. It could cause a frozen face, which is caused by paralysis of the major muscle. But it would be more valuable to tell them that the origin of the major muscle is actually located inferiorly to the Frankfurt line, and it is like 1.5 centimeter inferior to the Frankfurt line, and vertical line lateral 1.5 centimeter lateral to the lateral canthus. And number 3 is also very important to help our injectors to know the differences, because there is no universal anatomical structures. Take the frontal line, for example. We all know the frontal line is generated by contraction of frontalis muscle. However, in real clinical scenarios, there are tons of different frontal lines. We could have patients present with this long horizontal frontal line called the whole forehead, which is generated by 2 gigantic frontalis muscles that covers the whole frontal area. But also, we can also have patients with frontal lines in the shape of M, the letter M. This is caused by 2 bifurcated frontalis muscles, so suggesting there is actually no muscle in the middle part of the forehead. And also, from time to time, we can also encounter very short horizontal frontal line that is located only in the medial 1/3 of the forehead, suggesting this kind of patient will have 2 very small frontalis muscles, and these 2 muscles actually are very close to each other in the midline. And also, the patient could have very short, separated frontal line, which is caused by small frontalis muscle that is separated from each other in the forehead. So once we know the anatomy, It will be much easier for our injector to decide how to choose the dose, how to choose the size for injection. And last but not least, it's also very important for our injector to realize the danger hidden behind your injection. Take the injection for the chin, for example. We all know the injection of the chin could greatly transform the patient's appearance by forming the facial ratios. But we have to realize the risk that lies behind it. From time to time, there could be, although very rare, there could be cases like skin necrosis in the chin area and also tongue necrosis after this kind of injection. So to understand the mechanism, of course, we need to show our injectors the basic anatomy, such as the muscle and also the fat compartment in the chin area. But at the same way, we also need to tell what the vasculature is like in the chin area. So in general situation, the chin area is actually supplied by mainly by two ascending submental arteries. And this artery arises from the facial artery, which arises from the external carotid artery. And there will be many communications between the submental artery with the lingual artery. That is why injection into the submental artery can cause necrosis of the tongue. But in rare situation, the two submental arteries could actually merge into one big vessel. Instead of running laterally, it runs in the midline, and this is why in some cases it could be also risky if you do injection just exactly in the midline all the way to the back, because that is where the artery can be. And in a rare situation, there could be a very tiny communication branch passing through the mandible, connecting this ascending submental artery with lingual artery, which cause immediate embolysis of the tongue after the injection. So there could be three different ways if we accidentally injected in the artery and cause the necrosis of the chin skin or the tongue. But the question is it enough for today's injection if we want to achieve excellence or safety? We have to realize nowadays we're trying to treat with a three-dimensional face, which is dynamic and also changes with it. We're trying to rejuvenate the face, which means we really need to understand the aging changes of the face. So in addition to the very basic two-dimensional anatomy, we need to understand the three-dimensional anatomy, we need to understand the functional anatomy, we also need to understand the aging changes of the face. Taking notes, for example, all nose is very dangerous to do injections in nose because of the vasculature and communication with the intraocular vasculature, which could be the underlying mechanism causing blindness if you accidentally inject into the vessel. We can, of course, show our injectors all kinds of different variations in facial vasculature, but it would be much more helpful if we can also show them the safe layers of injection. This is actually a very interesting study. We try to show you the safe layers by doing section in different parts of the nose, in the bony parts, the cartilaginous parts, the nasal tip, and also the cardiac. What shows us is that although there could be a little bit variation in terms of where the vasculature runs, it could be a little bit superficial to the muscle, it could be a little bit deep to the muscle, but overall, in every size where the section, the plane inferior to the muscle layer is actually very safe. For the columella, the space between these two cartilaginous cracks is also a safe region for injection. So in this way, it will be much easier for our beginners or injectors to understand the safe layer, the safe space for injection. In the same way, it's also very important for us to understand the facial function, because we're dealing with a dynamic facial structure. takes the injection for the corrugator and for the cartridge, for example. This is one of my early case. She was a very kindly looking lady, but after injection she came back to me with this angry look. What happened then is I really didn't understand, really ignored the functional anatomy of the eyebrow. So if you look at the anatomy, you can see that the middle part of the eyebrow is actually controlled by 3 different muscles: frontalis, the corrugator, and the procerus. What happened then is to paralyze the corrugator, which pulls the eyebrow immediately. But we have to remember, while doing this, we also paralyze the inferior part of the frontalis, which pulls the eyebrow superior. But the procerus muscle is left unaffected. So as a result, the middle part of the eyebrow is pulled inferiorly by the remaining procerus muscle. And lateral brow, after injection of CrossFit, the lateral part of the curious ocular muscle is paralyzed, but the frontalis muscle remains unaffected. As a result, the lateral part of the eyebrow is elevated. And then the whole eyebrow is forming this laterally, superiorly tilting appearance, making the patient look really not easy to deal with. And also, it's very important to understand the aging changes of our face, because we're dealing with we're trying to rejuvenate our patient, right? So this is a very nice picture, which really shows you the time and the extent of the facial bone absorption with it. If we look at this picture, it's not difficult to understand why do we need to put in volume in the mid face, because you can see there's a big arrow in the mid facial area, because it's suggesting a massive bony absorption linkage. And this is also a very interesting picture. Shows you the rate and the time for facial fat absorption and facial fat action. So what we can learn from this figure is secondary to the periocular region, which actually we all know is like the first sign of facial aging. The subdermatic area is also one of the very early happening fat atrophy areas. So if you know this figure, it's not difficult to understand why do we need to put in volume in this area to help the patient to achieve rejuvenated appearance. So once we know all this, it's also still very important to go back to the anatomy lab, because what we just showed you is just on paper. But to learn the anatomy, you really need to do it by yourself. And in addition to this, it's also will be even better if you could have assistance from modern technology such as ultrasound-assisted or ultrasound-guided injection to help us to achieve accuracy and even greater safety for injection. So, in conclusion, anatomy education for today's injector is very necessary, and this is also very urgent because it has such a great diversity of background for today's injectors. And also, anatomy education for today's injectors should really be expanded from this 2D anatomy to this 5-dimensional anatomy, so that we have much better understanding of the whole facial dynamic and whole facial aging process. And in the same way, the old school anatomy is still very important, because that is a real way, and that is a real helpful way to help you to really understand the facial anatomy. And it will be even better to have the modern technique support, such as the ultrasound guidance during injection, to help us to achieve accuracy and to achieve safety. So thank you very much. I'm open to any kind of questions.
So thank you very much. We can see a very